am Dr. Jayaraj Damodaran, pediatric specialist, Universal Hospital, Abu Dhabi. As you all know, the liver diseases are becoming a major health problem the world over. That may be the reason WHO has announced a separate day for hepatitis infections. Do you know why WHO is giving so much importance to these viral diseases? We will have a look. You may not be aware that hundreds of millions of people are being affected by liver diseases the world over every year. And of these, about 100,000, 1 million people are dying every year due to hepatitis B and C viruses alone. So we have to understand the gravity of the situation. Hepatitis is an inflammation of the liver. It may be caused by several agents. Of these, the important ones are the hepatotropic viruses. Hepatotropic viruses means they have a special affinity to the liver. There are mainly 5 types of hepatotropic viruses, and of these we will name the important ones: hepatitis A virus, the hepatitis B virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus are the most predominant hepatotropic viruses. We will take one by one. Hepatotropic virus A, hepatitis A virus, is one of the comparatively less harmful viruses affecting us, but it is the most prevalent virus affecting the population world over, and mainly this virus causes infection in children. So hepatitis A virus usually spreads through the fecal oral route. That means when we pass stools in the open air, it gets contaminated with the water supply, and if we drink some unprotected water, it gets into our body and produces the infection. Through food also, through food handlers, if they are careless or if they are not cooking the food properly also, there is a chance that we get the infection. Another route of infection of hepatitis A virus is close body contact with the infected person. Hepatitis A virus usually spreads through water and food like infected vegetables. If we don't cook the vegetables or wash the vegetables properly, or some berries and all, if you don't wash it properly, there is a chance that we get the infection. Now we will see what are the symptoms of this hepatitis. It's a usual phenomenon what you see everywhere. When you get viral hepatitis, you will have fever and you will have lethargy, weakness, vomiting, and you may also have jaundice. That means yellowish discoloration of your urine, and also even yellow discoloration of your sclera, or even the whole body gets yellow. So hepatitis A virus is not very deadly and usually will not produce much problems. It may resolve by itself. No much treatment is required. One good feature about hepatitis A is that it will not produce chronic infections usually. Let us see what are the possible complications of hepatitis A. One is acute liver failure. So in very rare cases, the hepatitis A virus may produce serious illness in some children, especially not children actually, in adults they produce sometimes acute liver failure, and in persons who are immunodeficient, they are also prone to get this acute liver failure. Maybe 1 to 2%, that is all. Rare cases only will produce complications. In all other cases, they resolve by itself and no much treatment is required. One other complication is a prolonged cholestatic syndrome, that is this bilirubin, bile salts, etc., which are secreted by the liver, accumulate in the body, and that may also produce a little prolonged illness, that is all. Let us see how we can prevent hepatitis A infection. Hepatitis A infection can be prevented very well by taking vaccinations. Vaccination is very much available all over the world, and there are 2 doses for this injection. One is taken after 1 year of age, and the second dose is taken usually after 6 months to 12 months. So that will complete the schedule. Any child can be vaccinated with this. Another step we have to remember to prevent hepatitis A infection is that we should have a protected water supply, and food handlers should be educated well, and the vegetables and other items should be cooked properly. You should wash your hands properly, especially while handling a patient. All these precautions you have to take. Now we will go to hepatitis B. This is one of the most dreaded viruses in the world. Let us see how this hepatitis B spreads. Mainly hepatitis B spreads through 3 routes. One is sexual contact, the other one is blood and blood products, and the third one is a vertical transmission, that is from mother to the baby. Let us see how these infections spread. First we will talk about this blood and blood products. There are, as you know, there are many persons who used to receive a lot of blood transfusions, repeated blood transfusions, especially hemophiliac patients and a few other patients. They require blood transfusions regularly, or even on a weekly basis or monthly basis. So these people are prone to get hepatitis B infection unless the blood which is transfused is not screened properly for hepatitis B, C, and of course AIDS virus. So all these have to be screened properly, otherwise we have the chance to get hepatitis B infection. Other route is injection needles. So nowadays what we do is we destroy all the injection needles. We don't sterilize needles nowadays because sterilization many people may forget or ignore. So what we focus is destroying the injection needles. Another route of spread is through sexual contact. Sexual contact, because hepatitis B is very much available in the semen, vaginal fluids, etc., and sexual contact is one of the main routes of spread of hepatitis B to any person. So protected sex is also very important. Let us see how the mother gives hepatitis B infection to the baby. When the mother is pregnant, there is chance that the baby gets the infection from the mother directly through the blood, because mother's blood mixes with the baby's blood through the placenta. There is chance. So if that doesn't happen, the mother can give the baby still hepatitis B to the baby by the delivery. Through delivery, the baby comes in contact with the mother's blood, and this can cause infection to the baby. So these are the usual modes of spread, and even close contact can be a rare route of spread. So that is also documented in the literature, but that is very, very rare for hepatitis B spread. So why is hepatitis B so considered as so dangerous disease? Hepatitis B is considered so dangerous because it leads to chronic infection. Hepatitis B can remain on countertops for up to 7 days and can produce infection in you if you happen to come into contact with the countertops with a wound or cut. Also, if you happen to get in contact with an infected blood, you should wash the site properly. with soap and water or some detergents urgently. Also, if you are sure that the contacted blood is infected with hepatitis B, it is better to have immunoglobulins taken. Also, hepatitis B vaccination should be done immediately. So, this may prevent the hepatitis B spread. Let us see why hepatitis B is considered so dangerous. Hepatitis B produces chronic infection in most of the persons, especially children. Actually, younger the age, the more the chance of getting chronic infection. If a child less than 1 year happens to get in contact with hepatitis B or happens to acquire hepatitis B, there is 90% chance that the child may go into a chronic stage. But if the child is 2 to 5 years and gets hepatitis B infection, there is only 30% chance that the child may go into a chronic state. Here, the adults are comparatively protected. If they happen to have hepatitis B, there is only 2% chance that the person may go into a chronic stage. So, I am repeatedly telling about the chronic stage. Why this chronic stage is important? Chronic stage means these people can go into a lot of complications. That is cirrhosis of the liver. Many of you might have heard about cirrhosis. Cirrhosis, portal hypertension, etc. means scarring and fibrosis of the liver developing in later stages, and finally it may lead to cancer of the liver also. So finally liver failure and the person may die. So that is the importance of getting hepatitis B infection. So many of the precautions I have already mentioned. Handle the blood carefully, screen the blood properly before transfusion. Cuts and wounds, you should be careful if you are handling the blood, and injection needles should be safe. All these I have mentioned. So what else is the method to prevent hepatitis B? There is a safe method to prevent hepatitis B, that is vaccination, and it is a very potent vaccine which is available. Almost 2 doses can produce 95% protection. So, when do you give hepatitis B vaccination? We catch the child very early. Immediately after birth, we give the hepatitis B vaccination. So, that is very important. Each child should get hepatitis B vaccination immediately after birth. That is the first dose. And the second dose comes within 1 to 4 months of age of the child. So, before the child is 4 months of age, should get the second dose, and the third dose can go up to 18 months of age of the patient. So before 18 months of age, the child should get the third dose of hepatitis B, and this will very well protect the baby for many years. So that is the most efficient method to prevent hepatitis B infection. Now we will go to hepatitis C virus. Hepatitis C virus is another hepatotropic virus which is a dreaded one world over because it is more potent than hepatitis B virus in that it produces chronicity in very many people than hepatitis B. It usually will not produce much problem in children, usually produces chronic illness in adults. Children maybe they are not prone to the hepatitis C virus because it usually spreads through the same routes as hepatitis B, and drug addicts, blood transfusion recipients, all these are prone to get hepatitis C. Hepatitis C importance is that more than 85% of people who are infected with hepatitis C gets the illness. Maybe it is not well studied in children, that may be the reason why hepatitis C is getting more focus in adults. But of course children are also prone to that, and it is said that any person who gets hepatitis C virus infection, 85% chance is there that it may progress to chronic infection. Only 15% of people who get hepatitis C infection gets away with a mild illness without much problems. So as I mentioned, hepatitis C is also spread by the same routes of spread as hepatitis B. Only thing is chronicity is more. That is why it is dreaded all over the world, and complications are the same. Chronicity, cirrhosis, hepatocellular carcinoma, and all other complications. Another important problem with hepatitis C is that no potent virus vaccine has been detected so far against hepatitis C. So once you get the illness, it is really a problem. After 20 to 30 years, there is every chance that the person may die due to chronic illness. The other virus, hepatotropic virus, to be discussed is hepatitis D. Hepatitis D, we have an advantage with hepatitis D. The advantage is that hepatitis D itself will not produce any infection in any person. It has to get the help of hepatitis B to produce the illness. Hepatitis D virus is known as the smallest known animal virus in the world. So it is very potent. It can produce infection once it gains entry into the body along with the hepatitis B. Why it requires hepatitis B is that it has no separate envelope. This envelope, it takes as a loan from hepatitis B. The hepatitis B surface antigen is taken as a loan and makes an envelope for hepatitis D, and then it is capable of multiplying and produce infection. There are two types of infection, the co-infection and the super-infection. Co-infection means the virus enters along with the hepatitis B virus and produce illness. The super-infection is that the person is already having hepatitis B virus, and after a few months hepatitis D also enters the body and produces illness. So that is called super-infection. There is only a slight difference. Hepatitis co-infection means it is a rather acute illness, and super-infection leads to chronicity. But liver failure is more in super-infection cases. So how can we prevent hepatitis D infection? There is no separate vaccine available, but we can very well prevent hepatitis D infection by giving hepatitis B vaccination, because if the person is not getting infected with hepatitis B virus, there is no chance that he can get infected with hepatitis D virus. So hepatitis B vaccine can very well prevent both the diseases. Now we will go to the last virus, that is hepatitis E virus. It is similar to hepatitis A, and the spread is also similar. It is a waterborne disease, and symptoms are also similar, and usually it is a benign virus, will not produce much problems. And there is a good news for the pediatric population about hepatitis E virus. They will not be affected much. Usually affects the adults and the pregnant women, but it is very deadly in the pregnant women. If a pregnant woman gets the infection, there is a chance of death, and there is a potent vaccine available. It can be preventable with vaccination. So there comes to an end of our discussion about the hepatotropic viruses. Thank you all for a very patient listening. Thank you very much.